So tonight, we're talking a bit about Lyme disease and how to avoid it. So first of all, I must say thank you to Wayne for organising this talk, giving us a chance to speak to you guys. He mentioned to me that he'd been noticing quite a lot of ticks in his local area recently, so we thought it'd be a good time to raise awareness of Lyme disease and ticks and the really simple ways that you can keep yourself safe and just know what to look out for, really, especially with jogging pals. Obviously, if you're out running about in trails or fields or what have you, it's definitely something that's worth you being aware of. So a little bit about me. So my name's Rosie. I'm the Fundraising and Communications Manager at Caldwell Lyme Co. We're a small charity. We're only a few years old, but we were founded to fund research into Lyme disease. That's our kind of primary mission. But we also educate the public on Lyme disease prevention through things such as these free awareness talks. And we also provide information on the NICE guideline for Lyme disease, which is like a series of recommendations that doctors should follow when it comes to diagnosis and treatment. So if you ever have any questions about what you should expect from your GP, then you can get in contact with us and we can help you with that. So in this presentation today, we're going to cover what Lyme disease is and what ticks are. We'll look at some Lyme disease case studies. We'll look at the growth in Lyme disease cases in the UK and why that's important here. We'll look at where you're at risk of tick bites and how to avoid tick bites. We'll look to where you look for ticks to remove them and how to remove them properly, which is really important. And we'll also look at Lyme disease symptoms and what to do if you think you have Lyme disease. So first of all, Lyme disease, what is it? So Lyme disease is caused through the bite of an infected tick, and it attacks the nerves, joints, brain, heart, eyes, and can also cause a really characteristic skin rash. Now, you won't necessarily get symptoms from all of these areas. Some people find it's more concentrated in perhaps in joints or in nerves, but the symptoms are similar to a lot of other illnesses like ME, MS, Parkinson's, making it very tricky to diagnose. If it's not spotted and treated quickly, the infection can leave some patients with kind of really life-limiting chronic illnesses, things like permanent nerve and tissue damage. So it's definitely something worth knowing about and getting kind of treated and sorted as soon as you can. So what are ticks? Ticks are like very small spiders, and they've got 8 legs like a spider, and they live in long grass, bushes, woods, and even in parks and gardens as well. And what they do is they wait on the tip of plants, and when you brush past, they climb on, a bit like this picture here. It's called questing. Now, some of these ticks carry bacteria which can be transferred when they feed on the blood of their host, and can become a Lyme disease infection. Now, there's more research needed into the kind of proportion of ticks that are infected with Lyme disease, anywhere in the UK, but it's varied from 5% to 25%. I think the average is around 12%. So not every tick has Lyme disease, and if you get bitten by a tick, it doesn't necessarily mean you'll have Lyme, but it's certainly enough to just kind of be aware and have that information. So just to give you an idea, if you haven't come across a tick before, of just how small they can be and why it's so important that you need to look for them. So if you imagine that this is a thumbnail, these are the kind of different sizes of ticks. So the nymph and larva tick are basically the kind of younger ticks, and it's thought that the majority of bites that transfer Lyme disease are from nymph tick, the smaller ones there, possibly because of the life stage that they're at. But yeah, given how small they are, it really shows why it's so important for you to look for them, because you won't necessarily see them. So a couple of case studies, some you may or may not know. So Matt Dawson, rugby player, he caught Lyme disease a few years ago when he was training in Richmond Park, and he actually got one of the really kind of rare but serious complications with Lyme disease. It went into his heart, and he ended up having to have an operation. Which he's still kind of in recovery from today. So he's very keen about raising awareness around ticks and Lyme disease. And Adam is another case study here. So Adam, he and his mother don't remember him ever being bitten by a tick, but they think the only place it could have happened was his back garden. So a lot of people kind of assume that ticks are only in forests and, you know, long grass. But we do know of many people that do actually get bitten in their garden. The symptoms that started for Adam were a bit like fever and runny nose, aching all over, and eventually developed into paralysis in his face. You know, he couldn't close his eyes or eat or drink. He had, again, a quite rare but serious complication, encephalitis, which is basically swelling of the brain. He was given IV antibiotics in hospital, and I'm pleased to report that he's much, much better today. So when we're talking about Lyme disease growth in the UK, this is just a really kind of basic chart from the World Health Organization that shows how how number of cases had grown between 1990 and 2010. You know, it is one of the fastest growing diseases in UK and Europe. At a time, it was faster than measles and HIV. But again, it's one of the most under researched, so it's one that we know the least about, really. And there was a study released last year that found that annual cases of Lyme disease are actually thought to be 3 times higher than previous estimates. So they had been put about 3,000 a year, but the new estimates are more like 8 to 9, maybe 10,000 a year, which is about 24 people a day. But the true number really is unknown and is likely to be higher than that due to lack of reliable testing and still a lot of education needed around GPs around spotting Lyme disease. So when we're talking about risk factors for Lyme disease, there's a few things that, just a few bits of information and things that we need to consider. So ticks spread Lyme disease whenever they bite and feed on the blood of their hosts. They are in all parts of Britain. So if you ever hear a GP or go to see a GP, it tells you, you know, we don't have Lyme disease around here. That is absolutely categorically not true. All the recent studies have shown that Lyme disease cases were recorded in every area of the UK. So it's, you know, it's not just the New Forest, it's not just Thetford Forest. Obviously Cumbria, you know, it is a very rural area and is, you know, is kind of one of the hotspots for Lyme. So hopefully you guys are kind of aware of that anyway. Now you can be bitten at any time of the year, but May to October has the highest risk, and that's peak tick season. And that's because ticks like hot, humid, well, you know, more humid weather. So that's when they're most active, but they are able to be out and biting all year round. Now you won't feel ticks crawl on you or bite on you. You have to look for them to remove them. So this is probably pretty well illustrated by a couple of the images here on the screen. So if you see the one in the top right with what looks like a freckle next to the kid's eye, and the one on the neck as well there, they're both ticks, nymph ticks. So it just goes to show how easily they can be mistaken for a freckle or a speck of dirt, and like I say, why it's so important, you know, to look for them. So when we're talking about where you're most at risk, so like we've mentioned before, forests, urban parks. I was just sharing a post on our social media pages earlier about Bedford Park, Bedford Town Park. They had a couple of cases recently, and obviously Richmond Park is a well-known hotspot. Gardening, you wouldn't necessarily think would be a high risk activity, but again, you're in around plants, grass and foliage. Fields, so you know, if you're camping in fields, that's another activity, and obviously if you're around or working with animals as well. So there are some simple ways that we suggest for you to avoid tick bites. So the first is about tucking your clothes in. So you know, by that we mean, you know, tuck your t-shirt into your jeans, tuck your jeans into your socks. It's not the most sexy of looks, but to be honest, if you guys are going running, obviously appreciate that in the heat of summer you're not going to be wanting to wear you know, really long trousers or running trousers. You might be in shorts. So we also say if you are out, spray repellent on any exposed skin. I mentioned ones there containing DEET, but if you aren't so great with chemicals and you prefer to use more natural stuff, there are a couple of brands that are effective against getting rid of ticks that are natural. They're called Mozigard and Incognito, so they're always worth a one. If you spend a lot of time outdoors, you go camping a lot, or you work outdoors, we would sometimes suggest to spray permethrin on your clothes, which is an insect repellent, actually repels and kills insects. You can buy clothing with it actually kind of pre-treated with it, that lasts a few washes, or you can spray your clothing. Again, if you're going camping somewhere in that's quite tick heavy, that that would be something we would recommend for the clothes and maybe the ground sheet. We would say sit on a picnic cloth. So if you guys are out, I don't know if you have any socials, or if you're going out for a picnic, or even if you just need a break during your run, try not to sit directly on the grass. Try and put some kind of barrier in between you and the ticks. When you've been out, if it's for a long time, like say if you've been camping or you've been out for a really long walk with the dog, we would suggest tumble dry your clothes for 30 minutes when you get in, or put them on a hot wash, because that helps to kill the ticks. They can obviously come in on your clothes, and if they drop off wherever, they can live in your house for up to 3 weeks without a feed. So you don't want to be bringing any in if you can help it. And obviously the final step is checking each other and your pets for ticks. So again, that's just a reminder there. So you've got your tuck, spray, sit on a cloth, tumble dry your clothes, and check for ticks. So just a reminder as well, if you have any questions, obviously you can just ask them at the end, but if you've got anything, do feel free to type them in the chat function, and I'll come to them once we're finished at the end. So where to look for ticks. So we've got Bart and Lisa here giving us a hand, letting us know where we need to check. So I can't really put it any more delicately than to say that ticks like warm crevices. Basically, they're like little Spider-Men. There's nowhere that they won't go. So places that we say to check are like behind your hair, neck, behind your ears, particularly in the hairline for children tends to be one that appears quite a lot. In your armpit, the crook of your elbow, inside your waistband or behind your bra strap, again, somewhere that's snug and warm, inside your belly button, in your groinal area, especially for men, I'm afraid, and between your toes. And as Lisa says there, you might need a tick buddy to check the parts of you that you can't see yourself, such as, back of your neck or your hair. So this is an image that I normally put in because I think it can be quite useful. The left-hand side image, some of you might be familiar with, you may be familiar with both. Both are a tick, but the one on the left is a tick before a feed, and the one on the right is what a tick looks like after a feed. So if any of you have got dogs or animals, you might be familiar with seeing the one after the feed, where it's engorged. Ticks, as I say, can be as tiny as a poppy seed, but they can grow to the size of a baked bean once they've had a feed. I think it's just useful, say if that dropped off your dog before you noticed and you thought, oh, maybe it's a woodlouse or something, which is probably what I would have done. Then, as I say, at least and you know that you need to kind of get it outside or get rid. So we always give some tips on how to remove a tick, because it is very important that you remove it safely and correctly in order to prevent chance of the tick transferring bacteria to you. So as I say, we say never delay removing a tick. We know that there are some doctors or websites that might say, a tick needs to be attached for at least 24 to 48 hours in order to transmit Lyme disease, but actually there's not enough research to confirm that either way. Some of the most recent research showed that Lyme disease might have been transferred in as little as 6 hours. So, you might want to be, I'll wait to, see my doctor or go to A&E or whatever, but really it's good if you can do that as soon as possible. We would suggest to use a tick remover tool or some pointy tweezers, definitely not the flat ones, because what you want to be doing, as per the photo there, is getting as close as you can to the head, to the mouthpiece, to pull them out from there. Because if you use those flat edge tweezers, you're more likely to squeeze a tick in half, which is what you want to avoid doing. If you're absolutely desperate, you're not going to be, near civilization for, a number of hours, then you can scrape it off with a fingernail or credit card. It might leave the head in there, but it's the body that carries the bacteria. So that's what you want to make sure is removed as soon as possible. Whether you're using a twister tool or tweezers, lift straight up and do not squeeze the tick's body where you can help it. Once you've removed the tick, disinfect the bite and wash your hands with soap. And we always say do not put any substance on the tick. So we often hear a lot of old wives' tales about put Vaseline on it, burn it, oil on it. But what you're likely to do then is aggravate the tick, and then it's more likely to regurgitate the contents of its stomach into you, which is what you're trying to avoid. So we would say never to do those things. So here are just a few examples of some tick removal tools. Now I got one similar to the tweezers, but with more of a kind of hook bottom from Amazon for just a few quid. So it's, it's really worth, and the one on the bottom left here is a tick twister, which is another popular one. Basically you just slide that straight edge there, twist and pull up. And so you can get them both for a few quid on Amazon. It's really worth just carrying them with you. Popping them in your pocket or your bag. The top two there, so there's like a tick key remover, which is a slightly more old-fashioned one, and then the other one here, it's like a credit card. You can slot it in, and I don't know if you can see there for the eagle-eyed of you, but there's a tick just there between the little lip of the kind of duck, almost like the duck's beak. So I'd say it's just a few quid. It's definitely worth getting. So when you're thinking about whether you've got Lyme disease, so we've mentioned a bit about the symptoms already, but the initial symptoms, they can appear anytime within a day to 3 months. For most people, they'll start experiencing symptoms within the first week or so. And like I say, the initial symptoms are a little bit like the flu, so a fever, headache, neck pain, fatigue. And then here I mentioned some of the more kind of severe ones. So once it's untreated for a little while, it may go into the joints, as they could go into the heart. There's an image there of paralysed face. But the only symptom that is individual to Lyme disease is the bullseye rash. So there's a picture of it there. But not everybody gets the rash. It's only thought to be about 2 out of 3 maximum. Which is a shame, because the rash, and if you do get the rash is diagnostic, which means the doctor should diagnose you and treat you on that basis alone without blood testing, because it's actually a more reliable indicator of the disease than the blood test. Now, for some people, it will appear as a really clear bullseye, like the one in this photo, but it's not. It doesn't have to be as clear a bullseye than that. What's important about the rash is that it's flat, it's red, and it spreads over a number of days. Normally gets to more than a couple of 3 inches. For some people, it's bigger. So that's really what you want to look out for. For most people, it does develop some kind of central clearing. But yeah, don't think that it has to look exactly like a bullseye. Let's say it's about it being flat, red, and spreading out over a number of days. So again, here's just an example of some of the symptoms that some people can experience. So when we're talking about how it can affect the brain, for some people that's really quite severe, and it can cause cognitive issues, memory loss, headache and neck pain. For some people it affects their eyes. For some, their nerves, so whether that's nerve pain or paralysis or tingling, twitching and spasms. For their joints, it can trigger migratory arthritis, so joint pain in one or more area. And so we've also talked about muscle weakness, pain, stiffness and fatigue, which is why a lot of Lyme sufferers tend to get diagnosed with things like chronic fatigue syndrome and fibromyalgia, because they're quite similar symptoms. As I say, also issues with the heart and with the immune system as well. And again, just a couple of rash photos there. So I just wanted to draw your attention. Now we've kind of started talking about symptoms. One of the things that we were a little bit concerned about, or some of the Lyme groups have become a little bit concerned about, is that the symptoms for Lyme disease, the initial symptoms are a little bit similar to the initial symptoms with coronavirus. So, we have noticed there's been some people that have been misdiagnosed with coronavirus when actually they have Lyme disease. Obviously, both of them are, can be quite serious and need to be treated quickly. I thought it might be useful to put together just a list. As I say, I know it's a lot of writing on there, but what the similar symptoms are, and then the ones that are kind of individual to Lyme disease, and the ones that are individual to kind of COVID-19. So basically, the similar symptoms are, fever, chills, the muscle aches, fatigue, and sweat and headache. But things that you would get in Lyme that you won't really get in COVID-19 are the rash, if you get it, and neck and joint pain. And then the symptoms that are in coronavirus that aren't typical in Lyme disease are basically your respiratory symptoms and your like loss of taste and smell, the diarrhea, and the rash. I mean, I know not everybody that gets coronavirus gets those, but as I say, if it's respiratory, then it's likely to be COVID-19. But if it's a rash and just the kind of fever, headache, then definitely worth considering whether it could be Lyme disease. So if you do think that you have Lyme disease, go and see your doctor. If you know that you've either for sure that you've been bitten by a tick, or that you've been somewhere that where you may have been exposed to ticks and you later develop symptoms like the flu, bearing in mind that it can take up to 3 months to develop. See your doctor if you did develop the rash that we discussed. If you have strange symptoms in your nerve like tingling or paralysis. And we say never delay seeing your doctor if you do suspect Lyme disease. As like we've mentioned before, early treatment really is best for best chance of recovery. And if you do have Lyme disease, as with anything, we always say take all of the medication that you are prescribed, even if you start to feel better, because sometimes it can take a little time to just work on all of the bacteria that might be in the body. The standard treatment is 3 to 6 weeks of antibiotics, depending on your symptoms. And for most people who get on their treatment within 6 weeks, most will make a full recovery, and plenty even after that. But that's kind of the ideal. So I know we were talking about Lyme disease, and it can be a serious illness for some, but we don't want to scaremonger people. We're not about wanting scaring people to enjoy the outdoors. We know the benefits of it. We're really big advocates for the outdoors, people enjoying it, and how good it is for physical and mental health. We just want people to be aware of the risk of tick bites, so they can enjoy the outdoors but safely. So do continue to do so. Outdoor running is such a wonderful experience, especially with a great group of people. So look after each other, and share this information if you think it will help everybody. So I'm going to open to the floor for questions. I think we had one come through. So Helen asked, because I mentioned about making sure you remove the body if the head is left behind, does this then have to be removed? Yes, ideally, if you can remove it, if you've had to remove it because you're out and about, and if you can remove it with tweezers, when you get home, that would be the ideal. I mean, your body will eventually push it out on its own anyway. And like I say, the body is definitely the bit that you want to concentrate and absolutely make sure that it's removed. But yes, ideally, you'd want to remove it if you can, so that it doesn't go septic, which again isn't necessarily a real problem, and that is a preferable outcome than getting Lyme disease. But yes, if you can remove the head, whether that's later or otherwise, then do. So Amy said that her partner already has Lyme disease, unfortunately. Oh, I'm really sorry to hear that, Amy. He wondered if we had a list of private doctors in the UK, as he's getting nowhere with the NHS. Yeah, I mean, sadly, there aren't any specialists in Lyme disease on the NHS, which is a real kind of problem. And unfortunately, there's a lot of people that are in your partner's position. Our charity stance is that we don't feel able to recommend private doctors or testing, because we still don't know. Some of them are kind of giving private treatments that aren't yet kind of fully researched and vouched for the result. So for that reason, we don't feel comfortable. However, I would ask you, if you want, take down my email here and get in touch with me tomorrow, or send me an email tonight, and I'll pick it up tomorrow, and I can speak to you about perhaps about your partner's situation, and if he's been treated in line with the NICE guideline, or if they've approached his diagnosis like they should have as per the NICE guideline. And if I can't help in that route, then I'll see where I can pass you on, but I'm more than happy to help in that instance first, and then if there's anything else I can do to pass you on, I'll do that. Helen has said that we had 2 in the last week, so much more prevalent, and doctors did say we don't have Lyme in this area. That's so strange. I mean, like I say, Wayne said to me when we spoke the other day that they seem to be more prevalent this year. I'm really surprised about a doctor saying they don't have Lyme in Cumbria, in the Lake District, because even though it's not technically one of the hotspots, I would say it's probably like a higher amount of cases than the kind of average rest of the UK, and that doctor is absolutely 100% wrong, and I'm sure we could find them research to help him realise that, but yeah, sorry you've had to come up against that. Actually does make things a little bit more difficult. Jeff says, I've heard there are different types of ticks. Are they all Lyme carriers? Yeah, there's I think there's 3 types of ticks in the UK, or 3 types of main ticks, and it's the sheep tick, which was the images that I showed you earlier, is the most common one, and the one that is responsible for most of the transmitted cases of Lyme disease. I think the other ones are things like hedgehog ticks. There's hedgehog tick, and there's one other tick, but they're not as common, and they don't tend to feed off humans as much. So the one that I showed you earlier, with the kind of slightly red bottom, or certainly the kind of smaller black nymph ticks, they're the ones you want to worry about. So they do all carry, or can carry, some form of Lyme. But yeah, it's that sheep tick, or sometimes known as the Castelline tick, is the one that we want to be watching out for. Thank you, Steve. So very clearly explaining how could we support your work. Well, I have an idea for you that I'll show you in just a second, that's at the end of the presentation. But separately to that, I mean, if you're interested in Lyme disease and supporting the charity, as I say, our main mission is funding research to improve testing. I mean, you've heard just from somebody here tonight about how difficult it is to get diagnosis and correct treatment on the NHS. You can make a donation via our website. You become a monthly donor if it's something you're passionate about. If you know of a community group that you think would benefit from one of these free talks, we're more than happy to deliver. So again, just take down my email address there, and feel free to kind of link me up. And like I say, I've got something that you guys might specifically be interested in with regards to fundraising that I'll mention to you in a moment. And Lisa says, hi Lisa, why has there been such a growth in Lyme disease? There's a few thoughts around it. Partly climate change. I know it feels like people blame climate change for everything at the moment, but because ticks like hot, humid weather, it means that they're and because we've been having quite mild winters, it means that they are more active for longer, and so their breeding times are longer. So that's one factor. It's thought that increased awareness as well. So if more people are aware of what they're having, and if tests are getting even slightly better, although they haven't changed for years, then more people might be going to their doctors to get tested for it and then get diagnosed. So that's a kind of positive reason. So it's not necessarily that cases are growing, but perhaps people are recognising that they have Lyme. And also another factor that was discussed the other day is about the fact that we're kind of opening out and expanding and building on more green spaces. So humans are in areas more where ticks are, basically. So Amy was asking about how accurate do we find that the NHS tests are. My blood partner had to send his bloods off to Germany to find out he had it, like so many people. Another reason why we've given up on the NHS. So official research, which has been acknowledged to be low quality, the NICE guideline committee found that the test was about 80% accurate, but actually it's thought to be a lot less than that. The reason is because it looks at the body's antibody, like the response to the infection, not the infection itself, and because that leaves it open to a lot of window of error. And the Lyme disease bacteria is very, very clever the way it hides in the body. So I personally think it's much less than that. But even if it was for 1 in 5 people getting missed, if you think 10,000 people are getting Lyme disease each year, that's potentially, well, that's only the recorded number, but if you think 1 in 5 is getting a false negative test, that's hundreds of people every year that are getting a false negative and then not getting any treatment. So my heart really does go out to people that end up and then having to, like yourselves, pay for testing in Germany, perhaps get their diagnosis, but then the NHS doesn't accept the test results and they're unable to get treatment. So it's a really tricky position to be in, and that's why we're trying to tell as many people as we can about Lyme disease so that they can catch it early, particularly if they get the rash. It's almost a weird thing that you're lucky if you get the rash, because it means you're more likely to get the diagnosis perhaps than the blood test. But the better, information is power, like they say, and prevention is better than the cure. So if we can either stop people from catching it in the first place, or arm them with the knowledge so that they know what to look out for and get that treatment as soon as possible to stop those kind of chronic symptoms, then we'll have done a good job. Any more questions? I will tell you a little bit about, in case another one comes in. So this is what I was going to suggest in case you guys wanted to support us. So like many charities, we've kind of really struggled since the pandemic. A lot of our income is brought in through people that do fundraising challenges for us, running marathons, what have you, and with holding their own fundraising events. And given that a lot of them have been cancelled, our kind of income has really been hit. So we've come up with a virtual challenge event called Walk, Ride or Climb for Lyme, to encourage people to basically create their own challenge. So anyone can get involved, of any age, any ability. If they like to, I know it says walk, but running is fine. And that they can come up with a challenge that sounds great to them, and that they would encourage people to kind of sponsor them for. It can take place anytime between the 1st and the 30th, 1st of July, so this month, and the 30th of September. So, it could be, that you want to run a marathon in a month or a marathon in a week for you guys, or, that you decide you're going to run a mile every day. It could be anything, or you want to run past certain landmarks around your local way, or you can do it as a group, you can do it on your own, but we'd love to get the support of a running club like you guys, or individually or together. So the challenge is on our website, but I am going to send some information about it to Wayne, so hopefully he can pass out to you guys afterwards. But do, as I say, hopefully you saw my email address earlier, but do feel free. It's also on our, that's our website. So it's on our webpage. It's also on our Facebook and Instagram and Twitter pages, and we're on there too. So do feel free to follow us, for kind of more information and stories around Lyme disease and what have you. But yeah, if you can support us that way, we'd really love it. Thanks so much, and thanks again to Wayne. He's just saying, say no problem to anyone that can't make it. I've been recording the session, so I'll send the recording to Wayne and he can share out with you guys, perhaps with that information about Wear Lyme for Lyme. That's another of our campaigns, the Walk, Ride or Climb for Lyme. But thank you so much for tuning in, guys. I really hope you've enjoyed it. It's going to cut me off in about 30 seconds or so. So I hope you all have a lovely evening. Stay safe and well in these crazy times. And thank you very much. And thanks again, Wayne, for sorting. Thanks, guys.